Right now at 6:30, outrage over a policy change by insurance giant Anthem is causing the company to back down.
Anthem Blue Cross Blue Shield wanted to limit how long anesthesia can be used for, and Connecticut has now stepped in to stop this.
Channel 3 Eyewitness News reporter Owen Kingsley is live in Hartford, right outside the state comptroller's office, explaining the steps that were taken to get this in action.
Well, this all started Thursday, guys, or rather, I apologize. Yeah, actually, it was just yesterday on Thursday. The state's Comptroller Sean Scanlon, he gave a call to Anthem Blue Cross Blue Shield and got them to back down from this proposed policy change. Now, Scanlon, he oversees health care for hundreds of thousands of state workers and their families. The policy would have covered Anthem's plans in Connecticut, New York, and Missouri. It would have limited the use of anesthesia during surgeries and medical procedures. The only exclusions were for those under 22 years old and maternity care. The big concern was this could have resulted in denials of coverage for patients who may need more anesthesia because their surgery was difficult, unusual, or if there was a complication. Anthem quietly announced this new policy last month and has since been criticized by anesthesiologists.
We have to give anesthesia for as long as the case takes. If, for example, someone needs a gallbladder out and they're young and healthy, it might take 45 minutes. If they're older and sicker, it might take 2 or 3 hours.
Well, in a statement yesterday, Anthem also added that there's been widespread misinformation about an update to their anesthesia policy. They didn't specify in that statement what information they believed was false, but said that had that policy gone into effect, it never would have denied a claim for anybody who needed anesthesia services. In Hartford, I'm Owen Kingsley, Channel 3 Eyewitness News.